In the cervical spine, disc herniations sometimes occur after a twisting or turning of the head or neck, or repetitive activities like people that work in plants and factories. Sometimes disc herniations in the neck occur after a motor vehicle accident, like a whiplash type injury. But a lot of times in the cervical spine, there is no inside interventor injury. Patients just wake up with a crick in their neck, and then they'll start having pain radiating into the shoulder and arm. So at least half the time when patients come to me, they've not sustained any type of an injury. The conservative treatment options for disc herniations in the neck typically are the things that most people would think about, physical therapy being one. Medications to decrease the inflammation are very commonly used, like Motrin type medications, and muscle relaxants, because a lot of time there's a lot of muscle spasm that follows. One of the things that we feel are very important to conservative efforts is to do a therapeutic injection into that area. We typically call that an epidural steroid injection. It's just putting some steroid medicine in that area around where the disc is herniated in an effort to decrease some of the inflammation. And if that inflammation can be decreased, the disc a lot of times will shrink down on its own, and patients will not need any more aggressive treatment. Patients ask about disc herniations in the cervical spine or in the neck and when surgery is needed. Many times it's about pain. In other words, the conservative efforts we've done just have been unsuccessful. Physical therapy, steroid injections, medication. Then we get to the point where surgery is the only thing left to do. And that's the way it should be. Surgery should always be the last thing you do rather than the first thing you do. Once in a while, fairly uncommonly, fortunately, disc herniations are so big in the cervical spine that they produce neurologic danger. In other words, they're putting so much pressure on the nerves that the nerves are in jeopardy. They may have some paralysis or permanent nerve damage. And in those cases, then we press on with surgery much earlier. In neck disc herniations, we always do a fusion when we do surgery. Basically, when the disc herniates in the neck, it really is not functional as a good cushion or a shock absorber anymore. So basically, we have to do something. We have to either put an artificial disc in, which we do have. There's some controversy about, is that any better than doing a fusion? But basically, a fusion involves removing the entire disc, not just the herniated part of it, but taking the entire disc out and replacing it with a bone graft and putting a titanium plate on the front of the spine. And we do all of our neck surgery from the front if we can. Patients recover much quicker than the traditional way from behind. Frequently we're able to do this as an outpatient. We don't even have to keep patients in overnight. It's a great procedure. There's a nice path between this muscle and this muscle that's accessed through a little 1-inch incision. So really the only thing we cut is the skin, and so we go down between these two muscles down to the disc, remove that. That takes the pressure off the nerve. We put the bone graft in, and then that titanium plate on the front of it. And patients feel immediate relief of their shoulder and arm pain because the pressure's gone from the nerve. And then the neck heals up very quickly. Usually in about 4 weeks, patients are back to doing everything they want to do.